helping miracles happen in mid-Missouri.
I believe in miracles.
The Missouri Credit Union Miracles for Kids Radiothon on Y107.
Y107. So we did a little moving around over that break, and we are now joined by Natalie Harris, who does respiratory therapy. And we have Kristin. Can you explain what kind of our moving around situation was during that break?
I have a big vest on right now.
Yeah. Yes, you do, and you look gorgeous.
Oh, good. Thank you.
Tell you, I'm sorry it's not blinged out because I really, as I'm sitting here with Taylor and Travis, I wish I had gotten some blingy or gotten you a friendship bracelet. So I'm sorry. But this is a vest device. I am going to go ahead and hit inflate.
Okay.
So you will start feeling like you're airing up now.
Yeah.
Okay.
Feel that.
How's that going?
It's tightening up.
Okay.
Tightening up.
Okay.
Feels like a blood pressure cuff, but on my body.
It is.
Okay.
Very much so.
Okay.
But the difference is, let me push the go button. So it's going to shake.
Yeah. I feel. Oh, and it's speeding up a little bit.
It is. So what this does is it changes the airflow. It changes, a really unscientific way is to say it wiggles the chest wall and gets mucus loose and you cough mucus out.
And this is specifically for CF patients. You can hear it now in my
Can you give us a do, re, mi, fa, sol, la? Yeah.
Yeah. So that's actually how I whenever I'm working with a patient, making sure that we've got settings set up right, that's actually one of the things we do, is because I do need to hear you sound like you're singing either opera or having a really good time so that I hear that change in airflow.
Yeah.
So what this does, you had asked, or somebody had mentioned cystic fibrosis, which is where I spend a lot of my time. I'm the respiratory therapist that's in clinic with our pediatric and adult cystic fibrosis centers. The really cool part is whenever I get my pediatric patients over to my adult center, yay, miracle makers.
Yes.
But this is something we do twice a day, every day when you're well. So 30 minutes, our kids and school-age kids and middle schoolers and high schoolers, college students, adults, I'm asking them to do some sort of mechanical airway clearance twice a day for 30 minutes with their nebulizer treatments. The nebulizers help relax the airway, help break down the mucus, help fight some of the bacteria that can hang out in the lungs. And cystic fibrosis, yes, is what I hang out with the most, but we also have some neuromuscular disorder children. So children with cerebral palsy or spinal muscular atrophy or Duchenne's muscular dystrophy. And something causes them not to be able to take a big deep breath, control that chest wall, and cough.
Okay.
So this is basically kind of a precursor to a cough, kind of trying to get mucus to move.
Okay.
So I know I told you I get really nerdy when we talk about
it. It was so interesting, though.
Yeah.
So I'm going to increase your settings a little bit here.
All right. Well, get a little bit more wavy in the voice.
Yes. Say hello.
Hello. Yeah. Mid-Missouri.
That's awesome.
So
Yes.
you mentioned it's for some of the kids, it's 30 minutes that they spend with this, and so
twice a day.
So it's an hour full
right.
time.
And so how do you, it's hard for even us adults to, keep our attention span for 30 minutes. How do you keep, a kid's focus, for 30 minutes while this is going on at a time?
So I'm so glad you asked that because, yay, Miracle Maker.
Another one.
Sorry. I get distracted by Miracle Makers. So there are times where we work, myself and our social worker, our cystic fibrosis social worker, Keisha Nelson. She's amazing. But we will sit and talk to parents about, distraction techniques. So you can have the tablet, or you can watch Bluey, or you can do this one thing, and we make it special to treatment time. Sometimes it might just be, with some kids, it's mom just sits and has one-on-one time. Now, that's really hard, especially if you've got other kids, because let's be honest, what's the fastest way for kid 2 to want something? Well, mom's spending time with kid 1. So we work with them to try to figure things out. one of the things that I've actually learned from some of the CF RTs throughout the country is the idea of actually getting our kids up and moving. So as long as, if you can imagine, having enough space with those hoses and stuff, but let them stand up or be on a trampoline or do something and wiggle so that they're getting some of the energy out instead of just being stuck there.
I can see that too, like, because I'm like, okay, now I need to do something. Like, it is energizing, which is kind of weird.
So speaking of energizing,
we're gonna go up higher
now, Miss Kristin, you are getting into the more like middle school range.
Okay, wow, yeah, this is really shaking my voice quite a bit.
So if you were to give this like a percentile out of like the max, what is she at right now?
It looks like I've got her to 15, and 20 is our max.
Okay,
percent.
So it's not a percent.
Okay.
So it'd be like 75%.
Okay,
I guess.
gotcha,
I can't math.
That was good math. No, that was really good.
High five, sister. That was good math. That was
That
really
was
great
quick.
math.
It's because we had the school teacher program in yesterday. Guys, the math stuck.
So I am so glad you bring up the school teachers. They are some unsung heroes. Our patients can be in the hospital anywhere from 10 to 14 days at a time to have their IV antibiotic courses. And, the idea of sending a little kid home with an IV in their arm for a long term is not the greatest idea on the planet. So, these kids get to stay with us, and we are able to work with them. But of course, if it's during the school year, the last thing you want is for your child to be falling behind in school. Right. So having the opportunity to work with the teachers, having some of the great teachers throughout Mid-Missouri who have been kind enough to send the packets and the worksheets and have the classes make cards and send balloons and stuff to our kids. You guys are awesome, and it's so helpful. I'm not going to lie. I get in there and try to talk about science, and I usually get things thrown at me. But it's a really great community that we live in because everybody wants to help our kids. And we have the teachers working with the in-hospital teacher, which is amazing. And then we've got our child life therapists who I give a shout out to all the time because, my gosh, they help me figure out ways to get our patients deep breathing and singing and dancing and wiggling and whatever. But that doesn't involve me because they see me and they're like, oh no, it's treatment time, and I don't want it to be treatment time. So, okay, Kristin, are you ready for more?
Okay, we can do it.
She's
I can do it.
This. Okay.
My face is buzzing a little. That's kind of weird.
How about your nose? If you put your hand under your nose, do you feel the air without breathing?
Not much, but like a teeny tiny bit. Okay.
Well, you will.
So you're to 18.
Okay.
Or you can usually you'll feel puffs of air.
Oh yeah, I feel that. Yeah.
Yeah, and that's just
the
not
best.
because you're breathing, but because we're helping your chest wall and we're shaking you a little bit and helping the air move in and out and move along, which helps thin out mucus, and then hopefully if you had an infection, you'd be able to cough that mucus out, because the mucus, if you think of the Mucinex commercials and the Mucinex man, that's the dude we don't want there. Because him and his people, they're not helpful. They will, those infections stay there and cause some scarring in the lungs. And if you have scarring in your lungs, they're not working as effectively. So that's what we do this for, so that we can keep good lung function.
Yeah. I'm definitely feeling it. I'm honestly two more. Okay, we're gonna go two more. But honestly, I'm feeling. I don't know. These kids are kind of awesome for being able to do this for 30 minutes a day for twice a day.
I will admit we do stop about every 5 minutes or so and have them cough.
Okay.
Because this kind of does half of the work.
And then they got to get it out.
It shakes stuff loose, and then I have to get the kids to take a big deep breath and cough it out.
Sure.
But yeah, that's what this is. Yeah, this is totally part of our day. And trying to, let's see, you've made it 8 minutes. Hey.
Wow.
Hey. Yeah. Awesome.
There we go.
Oh my
now
gosh.
you feel like you can take a big deep breath.
I do. Is that the same for the CF patients that have?
And it's so funny to watch the kids because you can tell they've done this over and over and over again, and they're just like, okay, done, and off they go and run, and it's moderately hilarious. I also get some great tips from some of my patients because they're like, okay, now I need you to do this because it helps more, and I'm like, I love that.
Yeah.
I love that you're thinking about it, that you're engaging with it, and you're trying to get junk out.
Awesome. Well, thank you so much for showing us.
It's an eye-opening experience.
It is.
But like I said, we use this with CF. We use this with our neuromuscular patients. Sometimes kids after surgeries may have a pneumonia or an area that isn't quite getting as much air as they need, and we try to help them and try to get things opened up. So I'm really fortunate that we have a hospital here that we're able to provide specialized care for our kids.
And if there was anything you could say to anyone on the fence about donating right now, what would you say to them?
You're going to a great cause. Let's be honest. It's local. It stays here, and it is. You're truly supporting us. You're supporting your neighbors. You're supporting your family. You're supporting, your niece, your nephew, or you may be supporting the kid down the street that sells you the Girl Scout cookies. Let's be honest, people that we need to keep up with. But the majority of people don't have reason to need us until you end up needing us. On occasion, I talk about the fact that my now freshman in high school, my daughter fell when she was in 3rd grade. And I'm a respiratory therapist. I, at that point, had worked at the hospital for probably 10 years. But having to take my kid to the ER and figure out that she had internal bleeding, and you're like, whoa, wait a minute. No, she tripped at PE. She tripped in the gym. What do you mean she's got internal bleeding? And that made for an exciting week for us, but I was fortunate that, dude, I just rolled down the street. I just drove over from the doctor's office, not had to go to St. Louis or Kansas City, but we do have a transport team that I don't know if you guys have gotten to talk about our Children's Hospital transport team, a critical care transport team. Babies, sick kids, they can come here or we can take them elsewhere as needed. So we're a pretty cool place.
I think that's a million little reasons to donate. Become a Miracle Maker right now. $20 a month. 866-970-4483. It is the 18th annual Missouri Credit Union Miracles for Kids Radiothon on Y107.